So everyone who studies how to maintain brain function and not have cancer, not have heart disease, not have arthritis, it's always, what can you do about inflammation? The inflammation is a major marker, and the higher your inflammation, the sooner you will have dementia or heart disease or cancer or arthritis. So it's wonderful that we have here an anti-inflammatory activity to go along with the tart cherry and some of the other things that are in this unique ingredient that is giving anyone enough relief from some of the pain that causes people to toss and turn at night. The reason people turn over so much at night and back and forth is because they either have fibromyalgia or some arthritis. There's so many factors that have been inhibiting deep, restful sleep with lots of delta stage waves, and this all ties down to then that this single 2-ounce product, which is meeting nutritional needs of our body, is also bringing in plant-based herbal substances that are dealing with some of the factors that we, living on a poisoned planet during extremely stressful times, are certainly reacting to help cause this epidemic of insomnia, which some people say 60% of Americans state they're having sleep-related problems.
Well, Gary, again, if you ask your patients why they can't sleep, a lot of times it's because of pain. But what causes pain? Almost without exception, an inflammatory response, either from trauma or metabolic or hypoxemia or what have you. So if we can address the fundamental causes of that pain and let people have a lowered amount of cortisol because they're under less stress, then the body relaxes and the mind will go to sleep. So what you're saying about inflammation is, again, very, very important. And for those listeners who haven't spent a lot of time on Gary's website, I have to tell you it is a fabulous website and very, very informative, very rigorous in terms of its science. And, you know, life is a lot easier, Gary, when we know what we're talking about, right?
Exactly. But it's hard for people because, you know, Napoleon could not fight a war on several fronts. Nobody can, and it's hard for my average patient to be told that, gee, you're going to have to eliminate that food that you're sensitive to, and we have to identify it. Sometimes that takes almost a medical detective, certainly at least sometimes food sensitivity testing, and then you move from that into, if you measure all the infections that we have, well, your doctor would order $5,000 worth of tests to begin with. So obviously we have to go by what the published literature shows. We have these infections. Now, people have been totally lied to in the oversimplification to sell gene testing. Gene, just because everybody in your family has breast cancer and because you carry the BRCA gene, that doesn't mean you will get it if you choose to optimize your environment. The gene does not have to express itself. So there's so much to teach you between the F and the I and the G. And of course, I just state unequivocally, you breathe air, you have heavy metals. We burn coal, it goes up in the air, so we all have lead and mercury. So there's nothing to argue about. You just, what are you going to take? Are you going to take high-dose C or my power drink or oral chelation or zeolite or all of them as I do? The point is very simple, that when you get down to the T, the toxins, that is when we started just realizing that we didn't want our children to burn up in their bed, so we wound up putting a flame retardant, polybrominated diphenyl ether. PBDEs are now off the scale, off the chart in every mammal at the Arctic and the Antarctic. We released it in the environment, and it's tying directly to things as bisphenol A and phthalates do to lowered sperm count and interruption of normal hormone function. So what's exciting is that we're finding and giving you answers that are safe, that come from the earth, that are natural, that our body can receive the benefit without the risks. And it's exciting if we look at cataracts and just see that this alone can cut down, because as we point out in the Journal of the AMA, right out of Harvard, the level of lead in your bone, and you are born with 1,000 times more lead in every child bone when you're born than any child 400 years ago. So I have everybody on oral detox, oral chelation, some extra vitamin C every day, anything that'll help push out toxins. But here we are teaching all of you that there are wonderful things you can be doing now to enjoy a much greater health. So on my website, I chose, with the help of Dr. Brad Weeks, Vima will give anyone that wishes to really become involved in this PM and share this positive message with anyone. You can pick your own name. I like the idea Energy Sleep because that's what I saw, enhanced energy. So I chose that name. You could have a different name, Restore Sleep, something else. But then they set you up with a website. So any of you now that would like to say, gee, I don't want to just get 4 bottles from Longevity Plus for $10 at my next order. I'd rather get a case of it because it's all money back. If you take the whole case of 30 bottles, at the end of the month, $75 is gone, but you say, I think this stuff it's not good for me. You send the 30 bottles back, you get your money refunded. So we're trying to make this no risk. But for those of you who want to see, well, where else could this go, I'm going to let Brad Weeks explain to you a little bit more because he's already had some doctors get such positive effects in some of his clients that he's now finding many of them want to jump into something that in 2 months, the word is out, but there's millions of people around the world, and this company already has ability to deliver this in some 30 countries. So, Dr. Weeks, would you take a few minutes and tell our participants a little bit more about how there is a business opportunity here besides the health opportunity?
Yeah, excellent, Gary. I'm glad to. So it was on December 3rd of this year when I got a phone call from a fellow who had sent me samples of the Vima PM. And of course, like a lot of doctors, when you receive samples of something, you simply ignore it because we get those every day of the week, it seems. And I didn't pay much attention to it, but when he called me, I took the call, and he described that he had a safe and effective, non-addictive sleep aid for occasional problems with sleeplessness. Now, I've been practicing medicine, Gary, for 20 years, and I know that helping somebody restore sleep is a cornerstone of health. So I was very interested because I know that what's out there on a prescription basis is not good. In fact, it disrupts sleep. It makes you unconscious and horizontal and amnestic, but it does not help sleep. It disrupts sleep. So I was excited. I was all ears. I did my research on it, and I found that when I ordered a box of 30 of these for $75 plus shipping and handling and tax, and I gave a sample out to patients, that I would get a call back the next day. This product works right away. You don't have to tell it to the patient, try this for a month and let me know. The patient will call you the next day and say, man, I slept great. What is that stuff? Where can I get more of it? And that's where, Gary, they can go to your website. In your case, people that you introduce this product to, they'll go to energysleep.vima.com. But my medical doctors that I'm working with, they have their own websites. One of them is awakerefreshed.vima.com. One of them is goodmorning.vima.com. It could be schnickelfritz.vima.com. The company gives you a free website to anybody who purchases a product. There's no additional cost associated with that to become what's called a brand partner. So what happens typically is a doctor will order a couple of these boxes, 75 times 2, 150 plus shipping and handling, and simply give out samples to patients. Unlike most medical doctors in America, the doctors you and I work with ask their patients about their quality of sleep. Do you feel refreshed in the morning? Do you feel rejuvenated? Do you feel restored in any way? Have you felt renewed from your sleep? And if the answer is no to those, I say, and the other doctors say, well, just take this sample of Vima PM. It's safe, effective, non-addictive, generally regarded as safe herbs, can be used with any medications, and take this and call me in the morning. And when they call back the next morning, we're finding about 7 or 8 out of 10 are saying that was fabulous. One gentleman called me the next day and said he has been awakening twice a night for the past 6 years because of a rotator cuff pain. After taking 1 bottle of Vima PM, he slept through the night and awoke feeling fabulous. Again, Gary, I want to stress to our listeners, that was after 1 night of sleep. you and I know, Gary, when we teach people about preventive medicine, vitamin C, antioxidants, we're really working with more of an abstraction for patients because they kind of know the science and they know it makes sense, but they don't really feel the antioxidant effect right away. In this case, the Vima PM sells itself. It's an experiential product that within one night, the patients will call back and say, I want more of this. Now here's the fun. When they call back and say they love it, they want more, my staff will simply direct them to a website, a free website the company gives the doctors, and the patients will purchase from the website. Commission goes to the owner of the website, in this case the doctor, or if the patients or anybody else you give the samples to wants to become a brand partner themselves, that's available to them, which means the company will give them their website, and anybody that they in turn share the samples with will be buying from their website. It's viral marketing in that sense. The company's made it very easy to do so. All the details of how to do this, Gary, are on your website. People listening should go to www.energysleep.vima, that's VEMMA.com, and if they go /PM, that'll take them to the PM product. If they just leave it at vima.com, which is to say energysleep.vima.com, they can look at the other products the company has, but anybody who goes to that website, the owner of that website will get a commission, Gary. So we encourage people not only to use this product, but when they sample it out, let people know that they can have their own website, their own e-portal, so to speak, e-commerce website, so that it becomes a viral process and everyone gets a commission. Does that make sense?
That makes a lot of sense. And the next slide that we're showing lets people know that the company has managed to get the endorsement of Dr. Mehmet Oz and Dr. Michael Rosen. Now, Michael Rosen's head of wellness medicine at Cleveland Clinic, and most people know Dr. Mehmet Oz. And so they've done their due diligence. But in order to get these doctors' approbation and support, they BK, the gentleman that has started the company, has agreed that when he introduces a product like the PM, research will be done on the product to show what the product that he is selling will do. So I think that's an extremely important part. If anyone is interested in going further, they're going to be able to rely on a study that may be released as early as February of this year that will start to document what you're hearing about in this webinar today with Dr. Weeks and Dr. Gordon.
Now, Gary, you mentioned that Carl Ransberger spent $50 million on research for Wobenzyme, and you and I know that that is an exception. Most nutritional products, most companies selling nutritional products don't even pay any attention to research. So I'm very proud of BK Barranco and the Vima Corporation for sponsoring research. I think the next slide talks about Dr. Michael Bruce, who's the bottom of that current slide in the middle. He's also known as the sleep doctor. This is a gentleman who has been the consultant for sleep to WebMD and is well known in the sleep industry for his ability to help people diagnose and treat sleep. His book, Good Night, A Sleep Doctor's 4-Week Program to Better Sleep and Better Health, is a bestseller. And the fact that this is a gentleman doing our research is very exciting.